Well, we're going to go ahead and get started. And I know just webinars being the way they are, people will still continue, probably still continue to come on. But again, we really appreciate those of you all who are joining us. And we always like to start on time or as close to it as we can. So I'm Joy Hogge, and I'll be sharing this webinar with you today. And what we're going to be talking about, we're doing a series on what is a system of care, because you hear that term a lot, but like, what does it actually mean? And how does the Interagency Coordinating Council for Children and Youth fit into it? And there happens to be a fair bit happening with that council right now that we'll be going over. And so this is an exciting time to be having this. We've done 2 previous webinars on a system of care, and we're probably going to do 2 more, and they'll be on the 3rd Wednesdays of the next 2 months. I mean, it's Fridays. I can't tell my day of the week. The 3rd Friday at 10 on the next 2 months. And again, we appreciate our partners at Community Students Learning Center and the SEEDS project, which is the project that is helping us bring this to you today. For those of you who are not familiar with us, and this just lets you know a little bit about who we are. And this also, we always bring it up at the beginning of any presentation we do, just to hold ourselves accountable to you and to remind ourselves of what we've committed to you. So we're the only statewide organization run by and for families of children with behavioral health challenges in Mississippi. We support each other as parents and caregivers. And by caregivers, we mean anyone who's not a parent, but who's raising a child, like a grandparent, foster parent. Sometimes, you know, with adolescents, when they go out and pick their own family, anyone who is raising a child with a behavioral health challenge. So we support each other, and then we work together to make things better for our children. And making sure that we have a responsive system of care in Mississippi, which is what we'll be talking about today, is one of the biggest ways we work together. And our vision is that all children will have the opportunity to reach their potential and succeed. And our mission, so that's what we do, is to make sure that families are partners in their children's care. And sometimes people think that means we go around making families do stuff. That's not what it means. What it means is that our mission is that the system of care for children in Mississippi will be family driven. And we'll talk about that more in just a minute. You can see our core values define us, and our core values are every child and family. And I do want to pause here. I think everybody's probably, so many hard things have happened over the past year, and hard isn't even the word. You know, we had the pandemic. We also had to come, and I still don't know that we've gotten there, with a real reckoning as a nation with how people who are African-American have been treated, including in law enforcement situations. Very, very difficult things that have happened politically, regardless of where you fall in that continuum, and violence associated with that. And then this recent shooting in Atlanta, that for whatever reason the person who did it is giving, it brings to light some of the pressure and prejudice that people who are Asian have been under. So this is a small thing, but in the face of all of that, I want you to know from the bottom of our hearts as a family-run organization, and from the bottom of my heart as the executive director, we really do welcome every child and family. Any family who identifies as having a child with a behavioral health challenge is welcome to be part of us. We are committed to honoring diversity and to making everyone feel welcome, regardless of their demographics, of their political beliefs, of anything. We are here for you, and we are here for each other. We also value excellence, partnership, and accountability. And most of you are probably on our email list, or else you wouldn't be on this webinar. But if you're not, you can text 22828 and put in family 19, and that will get you on our email list. And I just want to make sure that Dominic knows he's on here as the chat person, and also to look up any registration or any legislation that comes up that we need to pull. These are our core beliefs about families, that families know their child better than anyone. Families are their child's strongest advocate, and systems should follow laws and policies about families and children's rights. And what we will be focusing on today is a state law that says this is how our system of care should work. Now, sometimes Mississippi, like all states, we don't always go by the laws that are on the books. But one thing we're going to talk about today is the potential of what could happen if this one was used more fully. So these are the goals for today, that you'll be able to describe the relationship between Mississippi's system of care and what the law says. Not every state has a well-defined law about what its system of care for children's mental health is supposed to look like. We do. It's model legislation for the United States. That you'll be able to explain what the Interagency Coordinating Council for Children and Youth, which unfortunately is abbreviated ICCCY, what that is, and that you'll be able to demonstrate understanding of how the Interagency System of Care Coordinating Council, or the ICCCCY, and MAP teams, or the Interagency System of Care. Oh, that should be, I'm sorry. Yeah, that's right. Interagency System of Care Coordinating Council, which is sometimes called the ICCCCY, and MAP teams are related to the ICCCCY, and that you'll be able to describe how the ICCCCY is and could be coordinated with other initiatives in the state. So I want to give you a little aside here. For those of you who have attended our trainings, or even if you're just here today, you may have noticed that our trainings, like on the front slide, the first slide, rarely mention anyone by name. That's because we always want to emphasize that what we share is about our mission, and it can come from any of us who are part of Families as Allies. It could come from anyone on the staff, it could come from someone contractual, it could come from a board member, it might come from a family who's working with us, who is the person who is the best fit for doing that particular presentation. Today, I'm going to take the liberty of talking about myself for a second or a minute, and why this particular presentation is very important and special to me. Now, so we don't typically do that, but I am taking that liberty. Before I was the executive director of Families as Allies, about 25 years ago, my husband and I moved to Mississippi when he was 26. And I became the director of children's mental health services at Catholic Charities. And I was a psychologist. I still am a licensed psychologist at that time, but I was working as a licensed psychologist then. And I had this opportunity to be the project director of one of the first system of care project in the state. And one thing that came out of that is this legislation that we're going to talk about today, and the system of care structure. And the way legislation goes, this legislation started and was passed into law in 2001, and it kept getting updated and improved through 2010. I had my son in 2000, and he ended up having special health care needs and also behavioral health challenges. So I stayed home with him for 10 years. Anyway, during that time, I worked on this legislation that we talked about, because I had seen what a difference Tessie Schweitzer, who is the person who started Families as Allies, what a difference it makes when we're truly family driven. I saw that as a provider. When I started changing the way I worked with families, then I saw what happened when families were at the table from the very beginning, when we designed policies. And then I saw what happened when they're side by side with people, all the other people in a system, developing policy and legislation. And I saw that during this legislation. So I was just staying at home with my son. I wasn't making any money, but I could do whatever I wanted policy-wise. So I learned so much from working with Tessie, and also at that time, Brenda Scafidi, who was over children's mental health services at the Department of Mental Health. So I lived and breathed this for 10 years and really, really believe in it. So I just wanted y'all to have that perspective. Okay, let's review. And this is some things we talked about last month. And looking at a system of care, we use all these really kind of dry sounding, maybe even boring terms, including system of care. And what is that really? And the example we gave last month is think about making chocolate chip cookies. The end product is all of those different things that go into chocolate chip cookies, like baking soda, flour, sugar, chocolate chips, that all have to be there. But each thing is brought together and it creates a unified whole that is different than the sum of its parts. This is not cookie dough. It's been through some transformation. It's been through some heat. These ingredients had to work together to turn into chocolate chip cookies. Same thing is true of a system of care. It brings together a lot of different entities and ingredients so that everything, the final product is transformed. We also talked about in any recipe, the one consistent ingredient is salt. Salt has to be in any recipe for the most part, almost like 99.99% of them, to make it taste better and also to make the other ingredients work. Salt makes the other ingredients work better. That's one reason why it tastes better. So the one ingredient that always has to be there is families at any level. We mentioned that sometimes salt can sting. And sometimes when their genuine partnerships with families start, whether it's at the provider level where you're working with an individual family, at the practice level or program where we're developing services, or at policy, the things families say and the things they bring to the table are extremely important. They can also be hard to hear. That doesn't mean we push them away. Salt can be curative and it's very necessary. So this is from the 1980s, because that's how long this model has been around, is the idea of what a system of care should look like. So it's all of those systems at the state level, at the local level, and then with an individual family, all working in a united, harmonious way. So it's one system of care. It's not these individual service systems, and the child and family are always in the middle. These are values and characteristics that are always true of a system of care. So if something is a system of being called a system of care and it's not this, then it's not a system of care. It might be something else. It might even be something else good, but it's not a system of care. It's family driven and youth guided. And that means families are driving the car and youth are in the car helping guide where they want it to go. It's home and community based. And that doesn't mean that everything is dumped on families to keep their children at home. It means they legit have what it means. It also doesn't mean that we set up programs where we go to their house 3 times a week and force services on them. It means that the kind of services and support they actually want to be able to keep their child at home and in the community actually exist. And a lot of those are informal. It's based on strengths, like starting with those beliefs about families that they know their child better than anyone. They're their child's strongest advocates, same with the child and youth, and individualized to that family. No one size fits all. Culturally and linguistically competent. It's coordinated across systems and services. So if you have a system of something you're calling a system of care and the only people who are at the table are mental health, you may be providing some good mental health services, but that's not a system of care. This is huge. It's connected to natural helping networks, the people that matter to families anyway. We talked about last month, when you think about think about a really hard time in your life. Who did you reach out to? Almost always people say their family, their friends, or their faith. That doesn't change just because your child has a serious emotional disturbance and you start receiving services. Those are still the people who need to be incorporated. And it's data-driven and outcome-oriented. So do families and youth actually get what they want? That's the values of a system of care, right? We mentioned that our mission is that families are partners in their children's care. And what we mean by that is that the system of care for children, not just for mental health, in Mississippi will be family driven. We did this exercise last month, but I just want to remind you a very simple way to remember what family-driven means is when you get in your car to go somewhere, think of what you know. You know where you want to end up. You know the route you want to take. You know what you're willing to invest in it. You know who you want in the car with you. You probably know some other things too, but families know that too. We know where we want our child to end up. We know what's important to us. We know who we want in the car with us to help us get to where we want to go and to help our child get to where we want to go, where they want to go. So that's what family-driven means. It's not, I care about families or we include families in meetings. It's about the family driving the car. They're the driver, and there's other people getting in and out, and you may be one of them, at both for their own child and developing services in the community and at that policy level. So this is the official definition of family-driven, and we'll see in statute that there is actually this statute we're going to look at. It says our system of care shall be family-driven. This is the definition of what family-driven means. So I'm just going to hit the highlights. The family-driven means that families have primary decision-making role in the care of their own children, as well as the policies and procedures governing care for all children. It's not about setting up a bunch of stuff and then asking families to come do it. So what does the law say about Mississippi's system of care? This is all based on a bill, and it's now in statute. So this is the law in Mississippi. Everything we're getting ready to say from here on these slides is taken directly verbatim from the law. The final version of this passed in 2010. So it's been around for 11 years. All right, the purpose of this law. So it's to, we're going to look at the bold. It's to provide for the development, implementation, and oversight of a coordinated, so that's all those different parts working together, interagency. So it's all the agencies, and that's at any level. And you'll see how that works as we go along. System of necessary services and care for children and youth, called the Mississippi Statewide System of Care up to age 21 with serious emotional behavioral disorders. So that's who it's for. And speaking of these youth, who require services from multiple services and multiple program systems, and who can be successfully diverted from inappropriate institutional placement. Now, I talked with another group a couple days ago, and it was less formal than this. And one thing that came up when we were talking about this later on, you'll see some things that they were asking about, like, does this apply to every child who presents at a mental health center? Probably not. This is for those children who require services from multiple systems and programs and who can be successfully diverted from inappropriate institutional placement. So one thing that's implied but not spelled out here is these are children who are at risk for institutional placement, like going to the state hospital, going to a private hospital, going to a psychiatric residential treatment facility, going to youth court, and ending up in detention, being placed out of state. This is for those children. And we all know them. We all may, some of us may be parents to them who are listening to this. That is for who this law was developed for. All right. And you can get these slides. They will be on our website within a week or two. And then you can also get the recording of this, this webinar. So the next thing is, what should this, like, how should this system of care be conducted? Again, directly from the law. So let's just look at the highlights. The most fiscally responsible, and that means cost efficient manner possible, based on an individualized plan of care which takes into account other available interagency programs. So this is talking about that child who needs all these supports and services from all these different systems, having a way to get an individualized plan of care. It doesn't say that every system does an intake and then every system asks the family a bunch of questions and every system then comes up with a plan of care that they ask the family to sign off on. It's talking about an individualized plan of care which takes into account all of those things and that it's tied to clinically and functionally appropriate outcomes. And ignore that 37 because that's a line number from copying it from the legislation. So it should be tied to things that are going to help that child do better functionally, like in their home and in the community. And that just makes sense if we're trying to keep children from going to institutional placement. Now, keep in mind, this is all directly from the law. Now, how's this system of care supposed to be conducted? The Mississippi, again, quoting, statewide system of care shall be. It's not like, well, if you think this will work, or if you're working with families where you think this will work, or if it's a program for mental health, this is saying, this is what it shall be. This is the law. Child-centered, family-focused, family-driven. The reason this is underlined is we just read the definition of family-driven. And there's characteristics that go with that definition we didn't go over, and values. And one of those is working in partnership with family-run organizations like ours and youth-guided. It's based in the community. It's culturally competent and responsive. And it shall provide for several things. And you guys can read, so I'll let you look at these, but I am just going to read the bolded ones. Prevention and early identification and intervention. So there was this recognition in 2010, although we didn't have a lot of supports for it, that problems need to be identified early. That means early in the course of a problem, like when a child first starts having a problem at school. It also means from a very young age. So early childhood work is very important. Smooth transitions among agencies and providers and to the transition age and adult service systems. So there should be this coordination so that all the services that a child needs are being coordinated. Their family doesn't have to go out and find them. They don't have to call 5,000 different places. Some care coordinator or case manager is not having to do that either, that the mechanisms are in place so that that's being done. And again, these are for the children who are involved with multiple systems and have the level of intense needs that they may need to, if these things don't exist, end up in an out-of-home placement. Again, this is the law. Family participations in all aspects of planning, service delivery, and evaluation. Integrated services with coordinated planning across child serving systems in Mississippi. So this should be happening at the very top. These are the types of services that a system of care should provide. Again, I'll let you read these. I'll just leave this up here for a minute. When I first started doing training on this, which would have been shortly after this passed, like in 2010, people would look at this list and say, there's a lot of stuff that's on there that we don't have. Now, also the statute makes it clear that it's not saying if you have this, this is enough. It's saying that there should be this comprehensive array of services that families find responsive, and that it should include at least these things. Now, I think we probably have more of these things. I don't know that they're coordinated, and I don't know, we're supposed to be data-driven and outcome-oriented if it's truly a system of care. What are we finding out about how families actually experience these systems or this care. Like with wraparound is a big one that's kind of been on the radar screen recently. That's really increased in Mississippi. But do we know if it's being delivered in a way where families actually experience it as helpful? That's just one example. All right, now we're going to get to the big topic. Who oversees this system of care? This is exactly the quote. There is established the Interagency Coordinating Council for Children and Youth, hereinafter referred to as the ICCCY. So these are the people that are on the ICCCY. And let's see, you go through the first 6, and they're the executive directors of the state agencies that have to do with children's services. Then the person in my position is on it. So the executive director of Families as Allies, the attorney general, a family member of a child or youth in the population, and that tells you who appoints these, a youth or young adult, a local MAP team coordinator, we'll talk more about MAP teams, an individual with expertise and experience in early childhood education, an organization that advocates on behalf of, and this really needs, the language in this needs to be changed because it's not person first, to say citizens with disabilities, a faculty member or dean from who helps train people to do system of care work. And you can see some of these people, like there's only one state superintendent of public education. There's only one executive director, Department of Mental Health. There's only one person in this position I'm in at a time. There's only one attorney general. So some of these people are, you know, they just are who they are that are on here. And then some, you can see who appoints them. So that's who is on this ICCCY. And this is their duties. Now I did go through, and I didn't put the line numbers, but what I did, because it's throughout the statute, I pulled from every place that said the ICCCY is supposed to do this. I put it on here. So they're supposed to designate necessary staffs of their departments to assist the ICCCY in performing its duties and responsibilities. Okay, this was a very interesting exercise to do as someone who's on the ICCCY, because, you know, I told y'all I worked hard to get this legislation passed. And it was probably because of the other people working on it. I'm not taking credit for that, but I learned so much. But I don't know that I had really thought about in my role here at Families as Allies, if I'm really committed to this, I need to be designating necessary staff to help with it. Now, we have a very small staff. One thing this made me think about is it may mean where I need to start is things I'm having the staff do anyway, is making sure that it's all going towards supporting what this law says. The ICCCY is supposed to meet and conduct business at least twice annually. They're supposed to work to develop MAP teams statewide, and those are those making a plan teams, and we'll talk about them more in a minute. We talked about them in a fair bit of detail last month, that will serve to become, now listen, the single point of entry for children and youth about to be placed in out-of-home care for reasons other than parental abuse or neglect. That's where those children who have the highest needs, who are involved with multiple agencies and are at risk for out-of-home placement, the first group that should be supporting them is the MAP team in that community. And then the ICCCY is supposed to be supporting the MAP teams so they can do that. ICCCY members are supposed to support the implementation of the plans of their respective state agencies for comprehensive community-based multidisciplinary care, treatment, and placement of these children. So this is talking about the state systems, but I need to do that too. I'm on the ICCCY. So when we're doing any planning at Families as Allies, or I'm applying for a new grant or whatever, or writing for a new grant, it's our organization applying for it, looking at How can I support this comprehensive community-based multidisciplinary care treatment and placement of these children? And then the ICCCY facilitates monitoring of the performance of the local MAP teams, which we'll talk about in a minute. Here's some more duties. Each ICCCY member, and I'm going to read this, shall enter into a binding memorandum of understanding to participate in the further development and oversight of Mississippi's statewide system of care. So if it doesn't exist, this is the group that's supposed to be providing the oversight to develop it and also to oversee it. For children and youth described in this section, and that's the beginning section, the agreement shall outline the system responsibilities in all operational areas, including ensuring representation on MAP teams. So that means whatever organizations are on the MAP, on the ICCCY should also be on MAP teams. Funding, so everyone who's on the ICCCY should be committed to helping find funding to bring all this stuff together. Data collection, because we want to be outcome oriented. Referral of children to MAP and A teams. And A teams, I don't know that there's a lot of them now, but it's a parallel team in the juvenile justice system and training. The ICCCY is to serve in an advisory capacity and to provide state level leadership like the legislature and to provide the state level leadership for all of these things and oversight to the development of the Mississippi statewide system of care. The ICCCY is supposed to ensure, so make sure it happens, the creation and availability of an annual pool of funds from each participating agency member of the ICCCY. That includes the amount to be contributed by each agency and a process for utilization of those funds. So to look at the money they have. Now, right now we're in a situation because of COVID where there probably is more money coming in, but typically, and I know in my tiny little organization, I'm going to look at this and say, there's no extra money. But again, maybe I should be looking at, are there funds that we're using in some particular way that could be used more effectively to do what we said we were going to do, but also support this whole process of having this comprehensive, coordinated system of care in the state. Now, there's two groups that help the ICCCY, and this is the one I got a little confused about when I was reading you the objectives because they sound so much alike. There's the Interagency System of Care Council. It's created to serve as the state management team for the ICCCY. I think we all know when we think of people like Dr. Wright, Dr. Dobbs, Drew Snyder, who's over Medicaid, Wendy Bailey, who's over mental health. I'm going to leave people out if I keep going, but they're and everybody's busy, but they're very, very, very busy in a way that they are probably not going to be able to sit down and figure out the details of how to do this. They can say, this is the direction we're going to. They can look at those things we just talked about, including how to find and develop and bring funds together and use them more effectively. But there needs to be a group that on the ground that's actually going to figure out how to do this. So the Interagency System of Care Council, which is sometimes called the ICCCY, is created to serve as the state management team for the ICCCY, with the responsibility of collecting and analyzing data and funding strategies necessary to improve the operation of the system of care and to make recommendations to the ICCCY and to the legislature. So these are basically, and the System of Care Council also has the responsibility of coordinating the local multidisciplinary assessment and planning teams, the MAP teams, and can apply from public and private sources for grants to do all of this. So this is basically, and the statute goes on and names the positions of people who should be on the ICCCY. It's basically within those state systems, the children's directors of any area of that state agency that touches on mental health. So there's like 2 or 3 from the Department of Mental Health who are at the management level, like over children's services or over something related to it. Same thing with health and all the other state agencies, plus family representation and that. And again, you can pull the statute and see who it is. I didn't list all of those. And then who else? All right, this is what it says about the MAP teams. The local interagency coordinating care MAP team or A team will facilitate the development of the individualized system of care programs for that same group of children. So for those children who are at risk for coming out of the home, at the local level, that MAP team, which they're now called Making a Plan teams, they're responsible for that. Here we see, now this is all directly from the statute. Each local MAP team and A team shall serve as the single point of entry. So that's where these children are supposed to be entering the system of care and re-entry to ensure that comprehensive diagnosis and assessment occur, and shall coordinate needed services through the local MAP team and A team members and local service providers for the children named in the subsection. The statute also says who should be on MAP teams. Let's see, we got a couple of comments. Let me see. Okay, I think it was people saying hi. And we're so glad everyone's here. So the statute goes on to say who should be on MAP teams. And it also says that at the state level, the people who are on the ICCCY are supposed to be making sure that in their systems, people from their system know that they're supposed to serve on these MAP teams, and that they find a way to make sure that happens. Now, I'm just going to pause here. I've shared a lot of information from the statute about what our system of care in Mississippi should look like, the values it should have, that it's overseen by the ICCCY, and there's these two groups, the ICCCCY, at the state level that is coordinating with it, and then the MAP teams. Now, I'm just going to pause and see if anybody has any questions or if there's anything that this has made you think about. Okay. I don't see any questions, but if you have anything, just feel free to type it. Okay, there is one really, really big question that I wonder if anybody's thought about. If there's I may be showing my age, coming up with a $64,000 question, which is a TV show that is old enough that it used to be featured on the front of the little mail out magazine TV guide. So I'm definitely showing my age, but y'all already knew that I was getting on up there. So there is one thing that I think might be occurring to people now. You've heard all this stuff that should be happening because it's the law. So this ICCCY we should have a system of care in Mississippi. All these things should be coordinated. All these state agencies should be at the table coordinating it. I should be on there helping. Is anybody thinking, why am I just now hearing about this? Why haven't I seen this happening? And people probably aren't brave enough to put that in chat. My guess says that thought has occurred to some of y'all, especially if you're working really closely with systems who should be a part of this and thinking, I'm out there with these children that need these multiple things from multiple systems. I didn't know about this. How do they access this? How does all this work? Okay, this is the bad news. Or maybe, I don't even know if it's bad news. It's not the good news. It's certainly not good news. The ICCCCY has not met since 2012. So this passed in 2010. And the ICCCCY was already meeting it because the original legislation that started it passed in 2001. And then, so it started to meet then, and it went well. And then it was strengthened in 2010 because some of those positions were added, some duties were better refined and all that. Then it met for 2 more years, and then it stopped. Now, there's a lot of reasons that could have happened. And the biggest answer is who knows? We don't really know. You know, I don't know that anybody like got together and said, let's not meet or let's stop doing this. It could have been because of money. Now that's usually the first thing that gets blamed. I'm not sure though, because one thing preparing for this really made me think about, and keep in mind, I helped work on this for 10 years and I'm on the ICCCY, and it didn't really hit me until I was preparing for this. How much I need to be thinking about anytime we're applying for funding, this bigger picture, and how to make sure I'm maximizing every dollar that we have available to us to do whatever we've committed to do, but also support this statewide system of care. So maybe I have more money than I think. It never ever feels that way, but so I think that could be true of state agencies too. Also time. One thing that did come up is that it takes a tremendous amount of time, of course, to do this work, but to coordinate this work. And does there need to be someone that's designated to do this work? Now, I thought about that too. And maybe once all this gets going, I don't know how I'll feel as someone who's on the ICCCY and committed to doing these things. But I also think, or is it more a matter of looking at resources, and this includes lack of staff, and saying, am I taking what I've got and maximizing this so that we're all working together towards building the system of care in Mississippi? And if we really did that, would some of the things we're spending time and money on now be as necessary? And maybe are we wasting some? That's not to say that we can't all use more money, time, and staff, but it's something to think about. Is it a matter of efficiency and priority as opposed to just a lack of those things? Another thing that happened around that time is there were lawsuits. There was Maddie T in the education system, which had been going on a long time. Olivia Y in the child welfare system has now been going on a long time. And I can't remember where it was in 2011, 2012, but it was going on, I do believe, or at least the things leading up to it. And welcome to those of you who are just now joining us. And then in the mental health system, and this was also Medicaid, there was a lawsuit brought against the Department of Mental Health and the Division of Medicaid in 2010, Troop v. Barber, about the lack of services and supports for children's mental health and for children to live in the community. And then the Department of Justice findings came out in 2011, and they originally included children. So there were several state agencies who were getting sued or about to get sued or had been sued. So it can be, and I'm not saying the ICCCY, that's not a reason for the ICCCY not to meet, but it was a time of great scrutiny of all of those systems. And it's possible, I don't know that this happened, but sometimes when I've heard people talk about this, I've kind of gotten this impression that there was a feeling of, if we start meeting, all this is out there publicly about what we don't have. And there's a lot of things we don't have. We don't have the system of care yet, I don't think, unless y'all are seeing it and I'm missing something. There's parts and bits in different places and some good things happening, but we don't have this integrated thing across the state. Do we really want to, does a state system really want to get in a room and talk about that when they're being sued for that thing? So I don't know if that contributed, but it might be possible. Okay. I'm sorry. There's one slide missing. I apologize for that. But, and it's the good news slide. The good news is, and some of you, if you follow our newsletter, you've definitely seen this. We have been trying to get the ICCCY going again ever since I've been here. And that's been about 10 years. Well, actually, it was going when I started, and to keep it going. that has had lots and lots of challenges and twists and turns and very difficult things that happened. But we were recently approached by the Department of Mental Health, Wendy Bailey, and she's the new executive director. And she said one of the things she wanted to prioritize is getting the ICCCY going again. So we have been working in partnership with her and the Department of Mental Health to get that done. And what has happened so far is we have reached out to all of those people designated in the statute, because a lot of them, since this hasn't met since 2012, have started their job since then. So they don't even know this exists. To let them know, this is what the law says. We're trying to get this council going again. And are you in? Will you help? I am very pleased to say that the outreach to the people who are currently on the ICCCY that didn't even know they were or didn't even know about the ICCCY, their response has been good. And I anticipate getting a meeting scheduled. I'm just gonna make sure if this is okay. Within the next, probably 6 to 8 weeks. You know, those people are pretty busy. So I don't know if we'll get it scheduled that soon, but they're all giving feedback. So that's very good. Wendy and I have both also committed to that all meetings will be public, which I think since it's state, there will be state funded people there anyway, it needs to be, but that we're certainly committed to that and making sure that each meeting has a time for public comment, either for people to submit comments or actually share them at the meeting, including if it's a virtual meeting. And then you'll see in chat that we have a survey out there. It's at the top of the chat box where anybody, families, you all, anyone working with families, any policymaker can give feedback about this is what I think the ICCCY needs to work on, because you never know where the best ideas are going to come from. These are some things that Wendy and I just talking and seeing different things. And you know, at Families as Allies, we definitely see the challenges across systems. I tell people it's not as if families are going to call us and say that, you know, this is this great thing that's happening. We hear about the problems, but we hear about the problems across systems. So it's an opportunity to look at what do we need to prioritize making better or changing. So these are some things. Y'all might have different ideas that Wendy and I have talked about as initial topics for the ICCCY to look at. Now, the first thing would be getting all that infrastructure set up and for them to know what the ICCCY is actually supposed to do and getting that management team, that Interagency System of Care Council going so that group can start implementing the recommendations. But here are some things we've talked about is how do you develop, because we've been working on this for quite a while, parent-peer support across systems so that there's a consistent approach that we know is based on some sort of outside standards, and there are national standards for this, that can help guarantee that if a parent is getting parent-to-parent peer support in any system, that we know there should be a certain level of quality that goes with it, and that it is focused on what we know would be, is typically most important for providing that kind of support. The whole idea of integrating education and mental health effectively. There's a lot of mental health services put into schools, but are they really supporting, helping those children stay in those classrooms, stay in that school, or are they still that old pull-out model that there's not a lot of evidence for? And how do, and I see there's a typo there, people in mental health, do they understand exceptional education and how to coordinate with child find? Because every child whose learning is affected by a disability should be coming to the attention of Child Find within that district. And sometimes mental health services and supports aren't necessarily coordinated with that. And sometimes they're used instead of the district going through that Child Find process. So how can we help that process work better? Early childhood, implementing wraparound with Fidelity. Again, that's a service a lot of families are offered and get, but it's not necessarily working in the way they want. And there appears to be some systemic issues, like the way we pay for wraparound in this state, that providers are given this lump sum, that there's more of an incentive for them to keep all the money within their organization, which is understandable that they would be tempted to do that, as opposed to using it in the way that wraparound was intended for it to be used, where wherever that family wants services from, that the money goes towards paying that whether it's inside or outside that organization. Transition services, helping children transition youth from the children's mental health system to the adult mental health system, or more importantly, transitioning to the things that adults do, like working, being in school, higher education, all those things. And the whole continuum of care, not just children going to a mental health center to get some traditional mental health services, but how can we set up medical homes, which are being set up in the healthcare system, but how can that model be used so that across systems, people understand what that means, and that there's mental health consultation available on, like, for primary care providers from the very beginning. So any place that's that early intervention where someone on the front end, like a primary care provider, is seeing a child might need some help, how can we make sure that's available to them? Now, that survey gives you a chance to say what topics you think the ICCCY should be addressed. These are just ones that have been thrown out there. There's some real opportunities with all this. One is there's another council that's focused on early childhood who has some of these same players, but not all, but there is a little bit of overlap, to coordinate with CCAC, because it wasn't, and that's that early childhood group, it's more out of the governor's office, wasn't necessarily meeting regularly, I don't think, and there's been a real impetus to get it going again. So if these two groups can coordinate from the very beginning, especially those people who are on both, and what do we need to do to leverage and enhance each other's efforts. And then looking at all those other interagency groups that are out there, and could some of them be folded together? How can we work together? Things like that. There's also, in the healthcare system, there's been much more of a focus on system of care. The system of care approach, I'd say, over the last 10 years. It had been around longer in the mental health system, but now both systems are focusing on that. And a lot of that's going through the Maternal Child Health Block Grant and HRSA. So there's a lot of opportunities there for how all that could support what we're talking about in the state, and also how it could be coordinated with what's already going on in the mental health system. We don't need two systems of care, one in the health system and one in the mental health system, but really one system of care, and looking at who does it make the most sense to do which part, and how can all that coordinate. In child welfare, there's been much more of a move over the past 15 to 20 years to move towards family-centered practice. And I think that's been more of an emphasis with the lawsuit in that system in Mississippi. And it jives and blends very well with the system of care approach. Also, the idea of building towards a children's cabinet, which would actually be those state agencies coming together, likely with the governor, to help coordinate all of their different services. And then for the ICCCY to support and feed into that. And some of those same people would be on both. There are, in 2015, the state was required to do have an independent assessment done of its mental health system. And on the children's report, there's some really good recommendations about, first of all, what the ICCCY could be doing, and also how a children's cabinet could be formed to support all this, and the ICCCY coordinate with it. Now, in 2018, there was some children's cabinet legislation introduced. Unfortunately, it was not good legislation because it got rid of everything except the children's cabinet, which undid a lot of things that need to be there, like the ICCCY, and also undid some things that are mandated in federal law. But this would all coming together give us a chance to work towards having a children's cabinet and look at the best models. And then just the opportunity for whatever comes from the public input, including yours. So don't forget to do that. I'm going to stop and see if there's any questions. And I'm putting our initial goals up there so you can see whether or not we met those. So the relationship between our system of care and what the law says, what is the ICCCY, how the ISOC and the MAP teams relate to it, and how it is and could be coordinated with other initiatives in the state. I know this is kind of dry and very policy oriented, but it's such an exciting opportunity for our state. I want to give you just a minute if anybody has any questions. And while you're thinking and maybe typing, I just want to mention again Community Service Learning Center, our Community Students Learning Center is the reason we were able to do this webinar today, our partnership with them. And that's a project in Holmes County. If you want to know more, they are on here and they put their phone number in the chat. I saw. See what this is. Oh, thank you. Okay. This is, and again, I'll keep checking the chat if you have anything. Our website, please like us on Facebook. And if you want to email us, you can get any of us at info@faams.org. And don't forget, if you aren't on our email lists, you can text to join. Okay, can you review who the ICCCY reports to? I know you said the CCAC is out of the governor's office. Okay, that's a very good question. Since it's in statute, there is language in there about how like they're supposed to be getting data from the MAP teams and all that, but there's really not a reporting mechanism specifically for the ICCCY in statute. And I didn't look at it for today, but those recommendations from that 2015 report, it talks about recommending that the ICCCY have a website, and probably would need staff for this kind of stuff. And then that what they do be reported out on that website. And then I think having a mechanism where they're also reporting back to the legislature. I don't know if that would be through peer or what. Might be something to look at. I'm sure everyone on the ICCCY is going to be really glad I'm on here saying this. But so that there's reports about what they actually worked on and what they got done, and what, especially these things like, does wraparound need to be set up differently? Do people need more support to be able to coordinate between the education system and mental health and do it more effectively? So more children are staying in school and doing better, and having those kinds of things reported out on, as opposed to we had this meeting and 4 people gave presentations. So that is my answer to that. And yes, the CCAC is out of the governor's office. And the Attorney General is on the ICCCY, but and she did say she's going to come. But that's not really a reporting mechanism. Okay. And the ICCCY survey link should be at the top of the chat box. Can somebody tell me if you see it at the top of the chat? I can see it, but sometimes things go away. Oh, you don't see it. Okay. I think that's weird that sometimes when people come on after something is yeah, Dominic, if you will put it to all attendees on there. Because I can't get this to copy. Thank you. And then we will also incorporate it into this PowerPoint, which will be on our website. And I think I've kept you like, oh, we're right at 11 o'clock. I will, I want to begin on time and end on time. I'll stay on here for just a minute. If there's any other questions, thank you all for coming. And you will get a survey about what you thought about this presentation, and we really appreciate your feedback and you being candid with your feedback so we can learn how to be more responsive to you. So if you would fill that out, it would be much appreciated. I'm not seeing anything else in chat. Okay, thank you all very much. Thank you.